Hello, good afternoon. Welcome to 26 Minutes and today we have Kim Rutherford. So it is 26 Minutes with Kim Rutherford. Me and Kim, we connected a few days ago when I was looking to speak with someone about the current affairs within the UK to discuss mental health of those within the UK and how it may be affected. So without any further ado, I'd like to introduce you to Kim. Kim, how you doing? You all right?
I'm good. Good, thanks. Not too bad at all.
Excellent, excellent. Would you like to give yourself a proper introduction, tell people a little bit about yourself and what you do for a living and how you really got there?
Yeah, so I said my name's Kim. I'm a director of a company called Dalton Wise Coaching Therapy, and what we do is provide what it says on the tin, really, coaching and therapy services to not just help people who are experiencing mental health issues, but through a recovery program, but also to help people prevent mental health and try and protect their mental health a little bit more through really good mental well-being practices. I am also the creator of a program called 8 Wise, which is exactly that. It is a program for very specific, focusing on the core 8 areas of wellness and well-being that helps people who, again, if you're going through any form of mental health recovery, the program will support you through very practical, tangible exercises that can help boost your mental health and mental well-being. But also, again, it's for those people who can feel like they're on the verge. You know, that feeling when you feel like, I'm really struggling a little bit, it could go either way here. It's for those people to try and pull themselves back and really try and protect mental health. And I'm based up in Liverpool, but I work nationally and internationally online as well.
Okay, excellent, excellent. So do you feel that this year you've kind of seen a rise in people that are coming to you at the moment?
It's been, yeah. When we went into lockdown, I thought, here we go, because we can't do face to face. Business will just fall on its face, and it went completely opposite way. I think what I started to see, which I was expecting to a certain degree, was those people suffering with health anxiety. I had no doubt that the people who had low level health anxiety, that was going to increase quite dramatically, mainly because all of a sudden 24/7 everywhere you looked, we were talking about, if you're this you're going to die, if you're this you're going to die, if you're this you're going to die. And so for those people who've got health anxiety, of course that's triggering everything that's going on as well. Then on top of that, we've really seen an increase in loneliness, and loneliness just brings a whole bag of mental health issues alongside with it. And I think we've definitely, so a lot of the clients that I've been working with, I'd say, fall into the core categories of health anxiety in general, loneliness, and the loneliness giving you the time to then reflect and overthink all the things that are going on in your life or have gone on in your life without any way of actually working through it, so that you don't keep it on top of you as baggage. And then there's been a lot with regards to relationship issues in general. And that's whether it's an unhealthy relationship, the end of a relationship, or spending time with someone who's incredibly toxic for you. So I'd say that my client base kind of fitted into those 3 core area groups.
Yeah, of course. And is there a kind of certain age range that you're seeing more of a pattern with? Is it more over the 45 mark, or are you coming across quite a few young people as well?
A good mix now, to be perfectly honest. Beforehand, my client group was probably 30 to 55. What they would normally have labelled themselves the midlife crisis years. That's who my client group always was. But actually, I've worked with a lot of students during lockdown with regards to a mixed baggage of, oh my God, can I go to university? This is rite of passage. Is it being taken away from me? If I go, am I putting my family at risk? And that summer before going, of, can I go out? Can I spend time with my grandparents? Can I see the people that I'm not going to be living with anymore? A whole bag of tricks going on with that age group, really. And I'd say probably 18 to 21. Really, really struggling. But the other end of the spectrum as well now, a lot of my newest clients are probably 60 plus. Those people who are, either coming to the end of their job, and so the reality of, if they get made redundant now, they won't have anything to go back to. There will be nothing out there for them. Those people who are completely cut off from friends and cut off from family. And I'm seeing a lot of genuine fear with regards to the concept of dying alone with my older clients. Those people who've realised, actually, if something happens to me in the middle of the night, that phone call, that person isn't allowed to come to me, or they can't get to me, or the NHS can't get to me as quickly as they used to. So there's a lot of fear with regards to that, the real mortality issues starting to kick in for a lot of people. So yeah, I'm definitely seeing a wider scope with the age groups I'm working with.
Wow. Wow. You know, it's very sad to kind of think, you know, the people that are isolated, they're on your own, what they could be going through, because, you know, I've lived alone before. I actually moved away when that's 8 years ago, 7 years ago, when I lived alone, and I found it very, very tough. And even as, you know, in my mid-20s, who, you know, mid-20s normally generally active, they got a lot of big friendship groups, but moving away and being isolated is when I found myself in big difficulties. And it was at that time that I decided to move back to be around people. I got very homesick. I miss my family. You know, that was only a phone call away, but you kind of start to think, if you're calling them every day all the time, that you kind of you know, you're kind of bugging them. So you're like, oh, I don't want to kind of put this all on them, etc. So, but it's also a very good thing that I picked up on there as well, is that we're kind of starting to see the younger generation start to talk a bit more, which when I was younger, mental health was never spoken about. Never at all. And you wouldn't ever have thought of going out and seeking help, or speaking to someone, or even opening up to your friends. So why do you think that the younger generation are now starting to actually speak up and talk about their feelings?
I think it helps that it is in the public domain a lot more now. I mean, maybe one of the benefits of social media is the fact that these conversations are happening. It's so like when you and I were younger and kids, it was all behind closed doors. Mental health was one of those conditions that you didn't talk about. It was a shamed condition, and it happened behind closed doors, and no one ever talked about it. Where now people are so open and so honest, and you can go onto Instagram and watch somebody diarize their entire mental health journey, and you can see that it isn't really anything to be scared of, because the reality of it is, whether you realize it or not, you've probably experienced it to some extent yourself at one stage in your life. You're certainly not going to escape this life without ever experiencing some form of mental health issue. You might not go to the extremes of mental illness, but you could be within the earlier brackets. So I think that's possibly why it's a bit more in the public domain. It's wider, it's not so hidden behind closed doors anymore. But I think we've also got to be aware of, we want mental health to become part of the mainstream agenda. We don't want it to become one of those throwaway things. And sometimes popularizing something does that. That's my fear for mental health agenda, is that with everybody in the world suddenly experiencing anxiety, that it isn't seen as a genuine issue or a genuine problem for somebody. Because for those people who are experiencing it to the extreme, when they can't leave their homes every day because of it, and people just throwing that away as, well, it's just a little bit of anxiety, everybody gets it, that's not actually helping the agenda in any way, shape or form. So I think it's great the young people are talking about it. I think it's great that they feel comfortable and open, and they really, really should, but we should never downsize the reality of what living with those conditions is really like for people. They're not throwaway comments. They're really big impact conditions that affect people's lives every minute of every day.
Yeah, of course. Well, you know, it kind of worries me that so many people, you know, loads of people are talking out, but it still worries me that so many people think that it's not okay to talk out for worry of being ridiculed, being looked at different, being treated differently. So, you know, I think it's very important, and that's exactly why I speak out as much as I can. I've set up this so then we can show people that it is okay to speak out, that, you know, there should be no shame in it whatsoever. We all go through mental health issues, as you say, at one point in your life or another. So if everyone in the world is going through it, then why are we not all talking about it a bit more? But you also said, you know, everyone experiences mental health, but not everyone experiences mental illness. So just for the people that do not know, can you explain the difference between poor mental health and a mental illness?
I think the easiest way to explain it is to demonstrate in the way of physical health. So, for example, everybody from time to time is going to get some form of cold. And you don't look at that as, oh, that's a physical health issue. That's a physical health issue. You've got a cold, it's affected you physically. That makes it a physical health issue. And it's the same with a mental health issue. So, for example, it's not, of course, at this moment in time, under everything we're going through, it would be strange if people weren't feeling some level of anxiety, because anxiety is that fear of the unknown and the fear of what might be. So at this moment in time, it's quite normal to feel some form of anxiety. And that anxiety at that level is absolutely normal. But when that anxiety then starts to develop, so it affects everything you do in your life, so you suddenly don't spend time with your friends and family in fear of that, or you're fearful of leaving the house, and that starts to build up closer and closer and closer, and moving into the illness areas. But I think when we come to the stigma of mental health, really what happens is people are very confused with regards to thinking mental health is mental illness. So they see things such as schizophrenia or any of those conditions which have been highly popularized on the news over the last 20 years with really severe storylines and taglines attached to them, and they assume that's what mental health issues are, and that's not what it is. It's everyday normal. You get angry, that's mental health. You get really sad, that's mental health. Anything where your emotions become out of balance and start to affect your everyday life, that is when your mental health has been affected. Mental illness is when it's actually become a condition, when it's become something you have to live with long term, and when really medication, you'll have to rely on it forever. But mental health, it should be like scales. It'll be good, it'll be bad, and as long as you learn to manage it, you get a nice balance. And that's what we really want everybody to be focusing on, getting as good a balance as they can and not confusing it between, again, in physical health terms, somebody having a cold and somebody having coronavirus. They're two vastly different things. And that's the same as mental health and mental illness. Everybody can and probably will suffer with their mental health, but not everybody will end up experiencing a mental health illness.
Yeah. Okay. Excellent. So, you know, at first, when I was going through mental health issues, not really knowing what they were, and then kind of realizing that, you know what, this is a bit of an issue. When I finally got to that place, I started to be able to spot the signs myself about when I knew that I was going to be going too low, and when to do something about it. So I actually had a mental health coach that I was speaking with that really did help. But if you could, what are the kind of main signs to really spot before you should really say, you know, I think I should go and speak to someone, or I think I should speak out, or maybe I should go and see my GP or something like that, whoever they're comfortable with going to see. What kind of signs, what are the signs there?
I think for other people, it's easier to see it in somebody than it is somebody to see it in yourself. For me, one of the biggest signs is the foggy head. That's the one, when a bit like when you've got a hangover, and the hangover the next day and you feel, oh my God, I feel groggy, it's affecting me head to toe, body, I don't want to get out of bed. That feeling, if you're feeling that and you haven't been drinking and you're feeling that 3 times, 4 times, 5 times in a week, that gives you some indication that the cognitive function in your brain isn't actually working at its best anymore. And that indicates there's something else going on. Now, a lot of the times it could be stress-led, so be really aware of what's going on from a stress perspective, because as soon as we become overwhelmed with stress, it will start to affect us. Obviously, we have an amygdala will then be affected, and that starts to create issues in the brain and in the body. But I would say number one symptom, if you're getting that foggy head, where you just haven't got the energy, you can't get out of bed, you can't think clearly, your aches and pains all over your body for no reason, that is telling you that your body has gone into some form of response to what's happening in your mind, and that's a pretty good starting point. From a behavioral perspective, if you identify that you don't want to get up, or you don't want to go out, if you don't want to see people for whatever reason, you just don't want people around you, if you find that it's that whole, when you stop living in the external world and more of your life is taking place in your internal world, that gives you some idea that there's something going on that you probably just need to go and have a chat with somebody about.
Yeah, of course. So I always spot my signs, and so I know that for 2 days prior, before I get the down, I'm very rushing about, you know, making sure that everything's in place, and, you know, oh, what have I left this on and that, and my brain really ticks. And I think over the 2 days that this kind of happens, I wear myself right out. I feel very anxious, and then all of a sudden I'm like, oh, I don't want to get up. I don't want to do this, and the curtains are drawn, the door's locked. The bell even gets switched off. It gets to a point when you don't even want the postman to put something through your letterbox because it's something coming into your house. It's, an open passageway to your kingdom that's being opened. And if I could, I'd tape it up at some point. So I kind of spot the signs now and kind of really know how to control things. And my partner's really on the same level as well. She has split personality bipolar. I've suffered with mental health in the past. And my sister as well, she was also diagnosed very late in life with autism, and she went another route of self-harm, which was a very, very tough thing to go through. So do you come across many self-harmers these days? Because when I speak to my sister, she still has very, very strong thoughts, but she stops herself from doing it these days. And it's a massive, massive worry to me. So it's something that I said to her that I'd really like to highlight with someone on the podcast. And do you have experience with patients that self-harm?
Yeah, I do. I've got I had some clients which there was a pattern of self-harm, attempted suicide. And then it was always an attempt. It was never a follow through, and it would go back, be okay for a period of time, then it would go back to self-harm. I don't necessarily think there's been an increase from my perspective with regards to those people. Mainly, again, self-harm is something people don't talk about, and in a therapeutic environment, it's very rare that you would get somebody come into you within the first 3 to 5 sessions and say, by the way, I'm a self-harmer. That really is something that takes a long time for somebody to build up to have that conversation with you. It's very different with suicidal thinking. People tend to they come up there, and that scares them so much that they're a bit more willing to tell you that one a bit quicker. But self-harm, it can take a long time for someone to actually tell you that's what they're doing. There's an awful lot of shame attached to self-harm for a lot of people, so it takes an awful lot. But yeah, there is a lot. I mean, from a self-harm perspective, because I'm not a self-harm specialist, and you really do need to go to a clinic who have self-harm specialists. But from my perspective, it would always be, I can't stop somebody from doing that. So it's, can I give you advice and guidance that teaches you how to do it as safely as you possibly can, whilst you get the support you need from the specialists?
Okay. So is it more of a release thing, rather than actually trying to cause long-term damage or even death from self-harm?
Yeah, I mean, if you think about the mind is in so much pain, it's not like you can just cut your head off and shake it all out. And that's a common thing people say to me all the time, look, like, I just could chop my head off and wash it out, but you can't do that. So that pain, you need to be able to manifest it into something tangible so you can release it. And that's what self-harm really is. It's just wanting to get rid of the pain, and that in that moment, because there is that strange thing with pain, we do have this euphoric moment when we have pain, because when you feel pain, it slowly then dies off. So there's a tangible feeling, a tangible connection to something. And so from a self-harm perspective, it's the release of the pain, and then all the chemicals that come with your body being in pain and trying to fix itself then after that.
Okay, excellent. So obviously, last couple of days we've had some announcements. We spoke a little bit about the first lockdown just at the beginning, and an increase in people that are contacting you. But we've had some announcements that on Thursday that we'll be going back into a national lockdown. How do you think this is going to affect millions across the country with their mental health?
We've got a huge. I think there was never a doubt that the first lockdown was going to create a mental health crisis. There was never a doubt of that. But now what we've got is experience attached. So beforehand, you had those people who thought they would never be affected by mental health, experiencing mental health conditions during lockdown. And now what they've got is the fear of having those come back. So now you've got added anxiety on top of those people that were experiencing something for the first time. Then you had those people who've always got that mental health issue going on, and they've been managing for a long time, and that's spiked up, and now that'll spike up even more. So there is very, very little out there at the moment to support people. You can do online, but can you imagine living in a household when you've got 3 kids at home, your husband at home, there is no privacy? How can you go and speak to a therapist when there is nowhere in the house to get that privacy to actually speak to people from? That's the reality of it. You can change therapy to being online, but the whole point of therapy is it has to be a safe space between the therapist and the client, and you can't create a safe space if, as a therapist, you have no control on the environment, and if the client doesn't have a safe environment to do that with. I mean, I've got clients who run out to the car and they'll sit in the car having a conversation with me because they know they can't have this conversation in the house. I've got other clients who talk to me in code because they can't talk to me openly and honestly, and that's not helping anybody. So we've got all of these amazing therapists in the world who are desperately wanting to help as many people as possible. But environmental factors really do play a huge, big part. So I think we're going to see a bigger spike, most definitely. We could see those people who had, so for example, my own personal mental health issue, I started off with stress and burnout. It then went to anxiety, quite severe mental health anxiety. Then I had depression, and then I had agoraphobia. Now that happened over a period of time, and it built up and it built up, and it moved into the next stage over probably a 12-month period. And that's without a COVID situation ever happening. Now, if you imagine me in that time, my health anxiety would have gone even worse. My agoraphobia would have got absolutely worse under this condition, under this situation right now. And we're probably looking, I probably would have gone down the self-harm route, if not worse. And that's just one person's journey. So someone would have looked at me at that time and thought, oh, she's got it all, it's all going perfectly well. But actually, it wasn't. And you're responding and you're reacting to the way life is and the people around you. You don't know how that's going to be. So I think we're definitely going to see a bigger spike. We're going to see different areas of mental health start getting triggered for lots of people, lots of different people. And I think we've got, the students are under attack at the moment an awful lot with regards to, there's a lot of a blame culture on the students at the moment. And for some of those students, that's going to really hit them quite hard. They will internalize that, and that will start to affect them as well. So we'll see it on all levels, all age groups, lots of different things, but it's going to grow dramatically.
Yeah, of course, of course. Do you think that the, regardless of already coming out of a lockdown and going into a second, do you think that this one's going to be a lot tougher because of the time of year as well? Obviously, when we had the first lockdown, you know, the weather was really good, but not for everyone. Some people were in flats, unfortunately, they didn't have a garden. But, you know, the kind of vast majority of people were able to still get out into a garden. It was light all day. Now we're going to see a lot more colder. It's going to get darker earlier. You can't go and really sit in the garden this time of year, maybe in your shed or something, but, you know, it's not quite the same. So do you think that the time of year as well is going to really have a big impact on the mental health as well as having to stay in?
Yeah, huge, because there's so many members of society that are already suffering with SAD due to the clocks have changed. We've got the darker nights coming in, so that's seasonal affective disorder. That's already kicked in for so many people. Yeah, now it's almost like prison. It feels like, where can you go? There is nowhere to go. There is nowhere safe to go because there's nowhere to go in the dark. There's nothing open anymore, and who wants to walk around a beautiful park at 5 o'clock, 6 o'clock at night in the pitch dark? No one wants to do that, or in the rain or anything else. So yeah, it's gonna feel like we're being forced to stay in a lot more. And I think obviously when they release the news, and you release the news with certain pieces of news attached to it, such as the armies are going to come and do this and these people are going to come and do that, there's a whole different level of fear going on there. It's not just we're staying in our houses, it's like we're forced to stay in our houses. That feels different than we're choosing to stay in our houses because it's safer. Now it's actually somebody's telling me I have to. Now my rights are being taken away, and that triggers off a whole different spectrum as well.
Yeah, of course. Well, look, it's been an absolute pleasure speaking with you today, Kim. But you know, we are going to wrap it up. But the one thing that I always wanted to ask a therapist when I had the chance to speak with one, not one that I'm paying to see, but just a therapist. Do you see the therapists see other therapists?
Yes.
Yeah.
I could not live without. Yeah, I see him every single month. I see a clinical psychologist every single month, and I know I get to that stage probably a week before I now need to go and see him, because yeah,
Yep.
it's a lot. It's a lot to take on other people's things.
Mhm.
Everybody needs to offload onto somebody else. That's the beauty of community.
Of
And yes,
course.
I have my person as well.
Excellent, excellent. Well, look, it's been an absolute pleasure, Kim, and let's keep in touch and speak a bit more. And yeah, it's been an absolute pleasure. Thank you very much for joining us today.
Thank you very much. It's great.
Excellent. Thank you.